I will see patients every month in the office that have the diagnosis of fibroids but don't have fibroids at all, and they have just adenomyosis. And that's occurred because the diagnosis was made with ultrasound, which is not as good of an imaging tool for the diagnosis of adenomyosis. MRI is the gold standard for imaging of adenomyosis as well as fibroids. And so we will see occasionally a patient come to the office. They have an enlarged uterus. They have the symptoms of fibroids, namely the bleeding and pain. But they have been ascribed this misdiagnosis because of having similar symptoms to fibroids and having an enlarged uterus, and assuming the uterine enlargement is due to fibroids. Whereas when we do the MRI, we can see there are no fibroids in the uterus. The junctional zone is thickened, and that's what's enlarged the uterus. And so they have adenomyosis and not fibroids. There are some women that have not only adenomyosis, but also endometriosis. They are similar conditions that are often found together because endometriosis is when those lining cells are found completely outside the uterus. So when these lining cells are located deeper in the uterus, that's adenomyosis. And when it's found completely outside the uterus, it's endometriosis. So they are very similar conditions. They can be found independently, or commonly they can be found together. If there's any concern that the diagnosis is not correct between fibroids and adenomyosis, or possibly wondering if you have both conditions, an interventional radiologist would be able to determine if you have both conditions. They use MRI, which is the gold standard for diagnosing adenomyosis, and a second opinion with an experienced interventional radiologist would be helpful.